BPC 157, Body Protection Compound 157. What is it? I picked 3 studies. These are in the information box. There's plenty more. Just go to pubmed.gov, type in BPC 157. Something that in the lifting community has become quite popular. It's called a gastric pentadecapeptide. Pentadeca 15, body protection compound BPC 157, and its role in accelerated musculoskeletal soft tissue healing, which is what we want to do, obviously, after an injury. So an injury to muscles or tendons or ligaments results from some form of incomplete or complete tear in the fibers that compose the tissue. The healing capacity and timelines of recovery for these tissues really do vary significantly. They depend on the cellular composition, the vascular nature of the tissues in question. So there's 3 phases of healing. We have that inflammatory phase, approximately 1 to 5 days, the repair and proliferative phase, approximately 5 to 14 days, and the remodeling phase, 14 to 90 plus days. Yes, healing takes time. And these tissues, like ligaments, don't get as much blood supply as muscles do, for instance. So it takes time to heal. Any way we can speed this process up will be a good thing, typically. So where does it come from, BPC 157? Really interesting. It comes from your gastric juices. And it was first introduced in overview in 1993, so almost 20 years ago. Again, it's a 15-chain amino acid. And what it's shown in research is that healing of the tendons showed an increased load to tendon failure and significantly higher functionality over a shorter period of time. So this is all a really good thing. You can read about this a little more. The defects were smaller in size and depth. The tendon integrity was reestablished. It improved the blood flow, counteracted muscle wasting. Also really interesting is the gastric protective effects, protecting the stomach cells, etc. You can read about this, and given that I have something called achalasia, my GI system, this interests me greatly for the GI system effects of BPC 157 as well. But here we're talking about the musculoskeletal effects. So increased expression of the growth hormone receptor to promote the beneficial effect of growth hormone in terms of healing in tendons. So how can you take it? There's orally via tablet, orally via drinking it, dermal patch, as well as injection, both intramuscular injection and subcutaneous, meaning below the skin injection. So this is what it looks like. On the right, you see the vial of BPC 157. It's a really tiny vial. It contains 5 milligrams of a powder. So 5 milligrams or 5,000 micrograms of a powder. Now this is very important. The powder must be reconstituted. That means restoring a dried substance to a fluid form that can be used for an injection. So that powder must be mixed with water, but it must be mixed with bacteriostatic water or water which prevents bacterial growth. So on the left, you see a vial of bacteriostatic water. You need a syringe, preferably about a 10 millimeter syringe with a blunt needle end that you can stick into the bacteriostatic water, pull out the amount that you need, and place it into the vial, which contains the BPC 157. So reconstitution and dosage calculations. This is really important. Here's a little bit of math for you. So the dosage that seems to be the most common is anywhere between 500 and 800 micrograms, mcg, micrograms per day, usually in divided dosage. So So remember, we're taking a vial that has 5,000 micrograms of powder, and we're going to add fluid to it. So here's an example. If the dosage is 250 micrograms that you choose to do BID twice a day, so 5,000 micrograms divided by 250 micrograms means 20 doses of 250 micrograms in the vial. So we can divide the amount of BPC 157 by the amount of bacteriostatic water you want to use to reconstitute. So follow me here. If you use 2 milliliters, ml, of bacteriostatic water, remember if you go back in the video, you'll see that that bottle had 30 mLs of the bacteriostatic water. So if you use just 2 mils of the bacteriostatic water, that means you'll end up having 5,000 mcgs in that 2 milliliters of fluid, or 2,500 mcgs in 1 millimeter of fluid. The syringe I use for the injections is a 1 milliliter insulin syringe. It has 100 hash marks. It has a 1/2-inch needle. So if you take 2,500 micrograms divided by 100, 25 micrograms for each hash mark or unit. If you fill the syringe to the 10 line, 10 times 25 is 250. So again, each hash mark is going to be 25 micrograms. And I want a dose of 250 micrograms, so I'm going to go to the 10 line. What does that look like? Here you go. Here's the syringe on the left. It has the 100 hash marks, and on the right you can see a little closer view of the units. So if you fill it to 10, that's 10 units. For me, that's going to make 250 micrograms, because once again, I use 2 milliliters of fluid for the reconstitution process. You could always use 2.5 milliliters for the reconstitution process, so 10 units would equal 200 micrograms. It's just some math. Got to take your time, play with the math, and get it right, because the dosage is very, very important. There'll be a video of me actually doing the reconstitution process and the injection to come, but I have a link to another video which is excellent to teach you how to do that.